Good morning. I think it's still morning. I'm Linda McVeigh. I'm the Executive Director of Country Doctor Community Health Centers. I want to welcome you to Carolyn Downs Family Medical Center on this very exciting, long-anticipated day. From our founding in 1968, we have been committed to the ideal that healthcare is a right for all people. Today marks a beginning in making that ideal a reality. I think it's fitting that the governor and King County executive have chosen a community health center to kick off open enrollment for Medicaid coverage and the exchange. Statewide, community health centers expect to enroll half of all the newly covered Medicaid patients. Coverage is here in community health centers, along with an extensive network of community organizations, are committed to making sure the people who need coverage get it. Our collective goal is to secure coverage for 140,000 people by 2015. With funding from the Affordable Care Act, community health centers have hired 91 additional workers in 180 rural and urban clinics across the state to make that happen. Country Doctor is part of that effort. Our healthcare access team of 6 enrollment workers was able to serve patients as soon as our doors opened this morning. It is especially fitting that this health center is hosting this event. We have the highest rate of uninsured patients in the state, right here in central Seattle. 53% of our patients have no insurance. We are proud that our state leaders agree that is unacceptable and took action to change it. On behalf of Country Doctor Community Health Centers, thank you for coming. I'd like to introduce you to Dr. Bob Crittenden from the Governor's Office, who will introduce 2 leaders who have been strong supporters of expanding health care coverage, and several people who will benefit from it. Dr. Crittenden was one of the first volunteers at Country Doctor in the early 70s. He's been fighting this battle for a long time. And we're glad you're on our team.
Thank you. Thank you all very much, and it's a pleasure being here. Just to give you a quick rundown, we're going to, I'd like to introduce our speakers, and we're also, after we have a chance to run through that, we'll have a chance to take questions. First I'd like to introduce, though, is Constantine, who is our county executive. And I'll just say that this county, King County, has been exemplary and way ahead in all its activities around enrolling people. So I look forward to his comments. After we get done with that, we'll have a chance to talk to the governor as well as to some of the clients that are here who have actually started their enrollment process, believe it or not. So, executive, please. Thank you.
Constantine.
Thank you. Thank you, Dr. Crittenden. Today, we're making history. When you think of the advances we now take for granted, Social Security, disability insurance, Medicare, national health care reform is an equally historic breakthrough. It was hard-won in Congress, and it is an opportunity that we will not let pass by. Here in King County, we have about 180,000 adults who will be newly eligible for free or affordable health insurance, 1 of every 6 adults in King County. As a society, we are paying for others getting sick. The costs of uncompensated care are already spread throughout the system. Whenever one person is rushed to the emergency room for a condition that could have been prevented with early attention, that's a bill passed on to everyone in increased insurance premiums or taxes. The only medical treatment some get is in our jail. Starting today, we are going to change that. I have set the admittedly ambitious goal of full enrollment for our uninsured King County residents. To reach that goal, I have mobilized every county agency that has direct contact with the public. We will create an expectation that all will become insured, a culture of coverage. This is an all-hands-on-deck effort. We'll talk to people wherever we meet them. flyers at customer service counters, restaurant inspectors sharing information with managers. Every office and counter and agent, regardless of agency, should connect you to coverage. Through our partner organizations, we've trained more than 500 in-person assisters, fluent in 34 languages, who will enroll the uninsured at 200 events at hundreds of public places like libraries and community centers. Some 80,000 people will be newly qualified for Medicaid, another 100,000 for reduced premiums on 40 different health plans available here in King County through the State Health Exchange. Instead of paying $1,000 or more a month for insurance, you might qualify, depending upon your means, for a premium of $300, more on the scale of an auto payment, or if you're worse off, perhaps $100, the price of your cell phone bill, or perhaps even less. What reform means is that if you suffer a catastrophic illness or injury and have no coverage, you are not facing personal bankruptcy. Our region is one built on innovators and entrepreneurs. And what reform means is that if you have a good idea, you can strike out on your own and start a business. You are able to leave your 9-to-5 job and pursue that dream. And you don't have to worry about losing your health insurance and suffering from that lack of security. So we're here to call on everyone without insurance to please sign up. Get out there and look. The security of a healthcare policy for you and your family is now within your reach. When people have access to affordable healthcare, they can lead healthier and more productive lives. And that's good for them. It's good for business. It's good for all of us. Thank you.
Thank you, Dal. We talk about a lot of numbers around health reform, bringing people in, getting more people insured, but it really comes down to individuals. Different people, real people, are being assisted by the Affordable Care Act and our Health Plan Finder. So today I'd like to introduce a few of them that can make a few comments, and maybe we can we get all of you kind of up here at one time, and is that okay? And just, here we are. This is Heather New. Heather New is a full-time student at Bellevue Community College, working on getting a nursing degree. And I'll let her talk about herself a little bit in a second. Next to her here is Vera Johnson. And Vera Johnson is small business owner of a nursery, I guess you'd call that, in White Center. And behind me over here, there he is Ben Smith. And Ben Smith has a long story he can tell you, but he's going to keep it short. But he's had a few medical problems, to say the least, and needs to have insurance if he's going to be healthy in the long run. So maybe I could turn it over to some real people. Maybe you could start off for me.
You forgot me.
Oh, Charles, I'm sorry. Charles, excuse me. Charles, I'm sorry. Charles actually is a Garfield graduate who played football against the governor there. And who won, Charles?
Doesn't matter.
Anyway, Charles, I'll let you talk about your own story in a second, okay? Okay, great. So why don't we go ahead, please, Heather.
Hello, my name's Heather, and I'm 33 years old. I'm a full-time student at Bellevue College, a member of the Honor Society, and I'm working on becoming a nurse. I went back to school after I'd been laid off 3 times in 5 years. During that time, I've lost my insurance, and it's led to me having to go through a 6-month journey through charity care in order to get a biopsy done. While it wasn't cancer, it was extremely frustrating and exhausting and stressful. I really need insurance because I do have several health conditions that need to be taken care of. Hypertension, eczema, allergies that can cause severe asthma attacks. Sometimes the best treatments for these are not the medications that are affordable, and I've had to skip medications in order to pay my rent. Thanks to the Affordable Care Act, today I'm enrolling for Medicaid, and now I'll be able to see my doctor when I need to see her, and I won't have to worry about my budget when she changes my medications.
Thank you very much. Appreciate that. And you will have a chance to talk to them as we move ahead. Vera, could you?
Hello, my name is Vera Johnson, and I'm a divorced mom of 2 kids. 4 years ago, when I did go through the divorce, I lost my health care, and my teenager lost her health care. So today, I'm here on behalf, in much gratitude for having options for affordable health care. I am an independent business owner in White Center, and this health care reform means that I am potentially not one step away from crisis anymore. I had to fight to keep my home from foreclosure. The economic downturn has affected my business and my livelihood. So this particular this healthcare reform gives me an opportunity to provide healthcare for myself, but for my teenager. And in these formative years, we all know how important it is to be able to take our kids to get adequate healthcare. So I'd like to thank you for this opportunity to sign up for healthcare. And I found out today I actually qualify for free healthcare, which was a surprise to me. I thought I would have to pay something. So I think this is an opportunity for a lot of people who have struggled with going to the doctor, not being able to afford health care at all. This is an opportunity for us to either pay a low cost for health care or provide free health care for those who need it. So I'd like to thank our governor and our executives for pushing this forward and providing that opportunity to everyone. And we're sort of leading the nation here today. So thanks.
Thank you very much. Appreciate it. I'll just say people without coverage go through terrible fear, worries with their family and their kids, and you've heard 2 stories already, and those are very real. Anyway, Ben Smith has his own story to tell.
Hello, my name is Ben, it's better known as Mr. Benjamin. I am blessed to be standing here today because I've had 2 open heart surgeries in my life before the age of 21. Due to a undeveloped aortic valve. I thought the second valve replacement would take care of the problem. You guys have to bear with me kind of sort of because I'm kind of like getting a little emotional because I'm able to get Medicaid, and that's something that's real important to me. Now, I never had health insurance through my work, but I had it through family members and a long-term girlfriend for X amount of years. As of 3 years ago, me and my long-term girlfriend had a split up and I lost my health care insurance. It was the worst recession and my work as a laborer dried up. I couldn't afford it on my own, so I thought I'd be okay. But last February, to be exact, February 2nd, I got a terrible headache and ended up in Harborview, where I was diagnosed with having a brain aneurysm. On top of that, I discovered that my aortic valve was malfunctioning. It was leaking. Now, and I may have to have another open heart surgery. I felt like I got hit by a bolt of lightning. That was real hard on me and my family at the time. Harborview had wrote off the costs due to charity care, thank God. But after I got out the hospital, I wasn't able to get any coverage far as disability or Medicaid. Now, today I found out that thanks to Obamacare, I can't be denied coverage because of my existing condition. I got enrolled today and found out that the care will be free for me, which is a blessing. And I'm also grateful and relieved because I have to stay on top of my heart condition. So now I want to thank the governor, King County Executive, and Obama for the Obamacare. Thank y'all.
Thank you very much, Ben. And Charles, I'd love to hear the story, sir.
Hello all, my name is Charles Jackson. I am a Seattle City Light here, and I really appreciate everything to go on with this Obamacare. I've been searching for some insurance right now at about a year and a half. I had my second hip replacement done in 2011, and I lost my insurance that I've always had after I done had one other hip replacement. I had a heart attack also in 99, and I still managed to able to keep my insurance because I continue on working. But now, since this last year and a half, I've been on the phone calling, I've been begging, I've been trying to find some kind of supplement insurance, and everywhere I went, I've been told that you're too young. They wasn't even caring about my medical condition. It's just that I wasn't at the age of 65 to retire, but I had medical condition. In between that time, I was diagnosed with high blood pressure and a diabetic. Repaired both of my hips that I have done in the last 2 years. And it has been really a struggle just to be able to manage. I can go any day. I have no insurance. I refuse sometimes to come up to see my doctor at Carolyn Downs because I didn't have the money to pay the copay. I refused to go and buy my medicine because I didn't have the money. I wanted something to eat or something else I needed to take care of in my household. So there's times I have went through months, certain medications that I need to help me to get along that I just wouldn't go buy because I didn't have the money. I didn't have the medical stuff to take care of, so I refused to come and create a bill. But now, as of today, I'm so blessed and happy to see that this is about. The thing that I told the lady that I talked to about when Obamacare came on, I want to be the first or the second one in line. And I was here early this morning at about 8:45 so I could sign up because I don't know, it could happen tomorrow. Matter of fact, it happened 2 weeks ago. I came for just a standard checkup, and they rushed me right out the door to the hospital. My heart was beating erratically. And so they didn't know if the stent that I have in my chest or in my thigh that was clogging up, that I had to be rushed up. And then 2 days later, right after that, I rushed back to the ER. So this is going to save my life and a whole lot of other people that's out there that's in the same situation that I'm in. And I would like to say thank you to all the people that was pushing behind getting Obamacare going on. And old-time rival friend right here, didn't meet. The governor and I played football against each other way back in '68, '69. And I want to just say thank you for listening to my story. Appreciate it.
Thank you, Charles. It's now my great pleasure to introduce the governor of the state of Washington, who has been a great leader in this whole effort, both nationally when he was back in Congress and also locally here. So, Governor.
This is a great day for the state of Washington. I'm just here to say this. Doesn't matter what kind of shenanigans there are back in Washington, D.C., Washington State's moving forward on health care. We are open for business for health care for the people of the state of Washington. And I am here to say it's about time. What Harry Truman started over 60 years ago, an effort to make sure everybody has health insurance, we're finishing today. And I'm delighted that Washington State is a leader in this country to implement this law in the most efficient way as possible. And you just heard the stories of what this is all about. This isn't some ideological discussion. This is about real people, real hard-working people who have real difficulties that are now going to have a great shot moving forward. When I listen to Heather and Vera and Ben and Charles, it makes me understand what this struggle is about and why it was worth pursuing for over 60 years. Now, Charles noted we played football against each other in the late 60s. He was a Garfield Bulldog, I was an Ingram Ram. Now, the sad fact is, the Ingram Rams happened to win that last game. And I've felt indebted to Charles ever since. And now that we got health care for Charles, are we even? Is this good enough for you? Okay, buddy, thanks a lot. Thanks, buddy, I appreciate it. But what this is going to mean is life itself for people across the state of Washington. It's going to mean that starting today, we're going to help prevent suffering, prevent disability and premature death in people that should be with their families and should be able to work. Starting today, nearly 1 million people in our state will have access to care and have choices that they can make. Choices that they make for themselves of what meets their particular family circumstances. And that's important. This isn't something anybody's being told what to do. Today, about 1 million Washingtonians have a choice to figure out what the best solution for them is. And they'll be able to sign up for expanded Medicaid that Ben talked about, for their kids, for Washington Apple Health, and to go on the exchange to get a coverage that meets their circumstances. And starting today, our state is going to save an estimated $280 million, save $280 million in taxpayer funds, and create an estimated 10,000 new jobs associated with expanded health care in our state. This is a clear economic winner in the state of Washington. And it's one of the reasons in our state that we embrace this on a bipartisan basis. Isn't it a great thing that our state, the real Washington, adopted a bipartisan solution while they're squabbling back in Washington, D.C.? Republicans and Democrats both got behind this bill in the state of Washington because it saved us money and helped lives at the same time. Now, no two Washingtonians are alike, so our health care choices should reflect that. People don't want a one-size-fits-all program. They want something that fits their families. And thanks to the work of our State Insurance Commissioner, Mike Kreidler, and the Health Benefits Exchange, people in Washington, I'm happy to say, can choose from a full 46 plans from 8 separate carriers. We've got good choice for the state of Washington. And I want to thank Richard Onizuka and others for working diligently to make opportunities to allow Charles to get up early to have these choices. Now, this morning, I issued an executive order directing all state agencies to look for creative and cost-effective ways to spread the word about coverage that is now available due to health care reform. And that work is already underway. Here's a couple of examples of what we're doing to get the word out. First, our Department of Licensing mails about 600,000 vehicle registration reminders every month. They're working with Washington Health Plan Finder to insert slips to make sure people know about this option. Second, our Employment Security Department is working to get information about the Washington Health Plan Finder to people who file unemployment in the state of Washington. Now, this is really important because we know when people lose their jobs, they typically lose their health care. And we want to make sure that their families don't fall into that black abyss of having no insurance. 45% of our residents who are unemployed are also uninsured. Now, these are just a couple of examples of our ongoing efforts to get the word out. But we want to ask everybody here in the room, we need to share our stories and the access available in this plan for people across the state of Washington. Don't be afraid to use your email or Facebook or anything else to share the stories of what is available to people all across the state of Washington. So today launches a 6-month, all-hands-on-deck program to make sure people know about access. And this is just day one. We've been at this now just for a few hours. We've got a long ways to go and a lot of opportunity for people to come up and sign up, and I'm looking forward to doing that. So thanks for being here. Let's go make sure everybody's got insurance in the state of Washington. Thanks a lot.
Thank you, Governor. Questions?
Hi, Bonnie Rockman, Bloomberg News. I am interested in how the Washington Health Plan Finder is functioning. I was at a clinic this morning and they said the site is coming down.
Yeah, the site started early this morning, about 4 o'clock in the morning. We had a lot of people going to it. We found that some people were having really good results of it, but some people were getting some sporadic slowdowns. And so they decided to put the site in maintenance mode to make sure we could get a high-quality service for everyone. I don't know if it's up back yet or not. They're still working. They may be still working to get a resolution of these issues. We want everybody to have a high-class experience. We're told that there's some other glitches that we've encountered. This is not news to us in Washington State, the home of Microsoft and Amazon. We know what launches are like. We're launching today, and we understood there might be some glitches on the way, but we are fully confident that every Washingtonian is going to have a chance to sign up for health care plans in the next several months so that they can have a plan that starts in January. We're going to have a lot of opportunities to do that, and we're going to make sure that that happens.
When was it put in maintenance mode? So it started at 4, about 4?
4:30.
4:30, and it was working then. I know,
Yeah, about
not that I...
7:30 it got slow.
About 7:30. So then since 7:30, it has been in maintenance mode?
It
or-
went in about 8:30.
So
and
went
it's-
in about 8:30, and
Yes.
so it stands right now in maintenance
As
mode?
far as we know, yes.
Okay, and now is it's almost 12:30, so 4 hours in maintenance mode. So do you have an idea of when it will come out of maintenance mode and when people will be able to use it?
Is Michael here? Michael, Michael is with the Health Benefits Exchange.
Yes,
He can answer
so will
that.
you go to the microphone and say your name is spell it as well.
Sorry about that. Michael Martian, I'm the Director of Communications for the Washington Health Benefit Exchange. As Dr. Crittenden said, yes, we went into maintenance mode this morning around 8:30. It is our intent to continue to run tests to make sure that we still are able to have everyone have a great experience on Washington Health Plan Finder. As the governor alluded to, we had some people were able to go through the application process with no issues. Other people were experiencing some slowdown. Pages weren't loading. In some cases, people weren't able to get onto the website. So we just want to make sure, as opposed to trying to, fix the tire as it's getting flat while you're still driving the car, it's much easier to pull over to the side of the road and get the situation resolved.
When you've pulled over, do you know how long you'll be pulled over? to the side?
My understanding is they're working on it right now, and we don't have an ETA. We're hoping for something shortly, and we're going to keep everyone in the loop as that becomes available. Our situation isn't unique. Evidently, there's others states that are running into some issues as well. But as the governor alluded to, this is not new. As a former Microsoft employee who's worked on a number of launches, this is something routinely you see with a huge software deployment of this kind or website deployment. You're going to have some bumps in the road. And again, success will not be defined by the first 6 minutes or 6 hours. It'll be defined by the first 6 months up until the end of open enrollment on March 31st and years beyond that.
I have a couple technical questions. It was supposed to be a launch at 7:30, is that correct for the
Correct.
site? But it launched early? So it's-
We had the site up earlier, just because the federal government had, on the East Coast, they were up earlier, so we just had it up early just to track some initial user acceptance testing and have it go.
And the call center, is that up and running?
Yeah.
'Cause a lot of folks
Call
are-
center, the great thing about the call center is, as many of you know, the call center has been open since September 3rd. So the call center has been operating with similar information as they have today with the website situation. So the call center is still up and taking calls. My understanding is they are averaging somewhere in the neighborhood of about 1,000 calls an hour. We had over 2,000 calls by 10 a.m. And those customer support representatives are serving people with the same information that you'd find on the website, much like they had been doing for the previous 3 weeks leading up to today.
There's a question back there. I heard somebody.
What is maintenance mode?
So maintenance mode is basically we are just taking the site offline. So you pull it down off the website so that you're able to work on it from the standpoint of having it in an isolated environment, so you don't have people still trying to get their information or to try to find plans on it, because when you're doing that, it makes it very, very difficult to get a smooth reading of what exactly may or may not be the issues on the website.
Any idea what's causing the problem?
Shutdown in Washington.
No, this has nothing to do with the shutdown. If it was only that easy, but it's not.
Any
Okay,
idea?
there's a question in front here.
This is probably
Say.
for the governor, but just for people to understand, if they still may be hesitant, kind of watching the situation in DC, is there anything that could happen in the coming days that would impact this Health Finder website here or coverage here for folks?
There's nothing that I can foresee that would slow down the state of Washington from progress. There are two things that I'm extremely confident in. Number one, those who, for decades, have been resisting efforts to get insurance for people in our country are going to lose. They are going to fail. Obamacare is going to move forward. It is the law of the land for 3 years. We've elected a president with over 5 million votes. The Supreme Court has ruled that it is the law of the land. It will move forward. Interestingly enough, and a certain irony, the Republican Party that shut down the government, Obamacare is continuing. It's a certain irony. So we are ready and able and willing to get people signed up. We have people signed up now, and that will continue. And I want to note that this has been about a 4-hour thing in our site, but we've got months to work on this. People are going to have a chance to get signed up. I'm very, very confident of that.
Is there any question back? Okay.
2 more questions? Well, how many people have signed up? Do you know?
At this time, I don't have that number.
Does anyone?
Yes, someone has that number. It's unfortunately not me, though.
Okay, and so it is possible to get it?
I will check. I will see what we have available.
One more?
Any idea what's causing the problem? Is it the traffic, the congestion?
No, actually, ironically, it has nothing to do. We had stress tested the system for 3 times the amount of volume we were expecting into the hundreds of thousands of visitors, so it has nothing to do with the traffic. I don't know. I'm not aware of any asteroids. I don't think we're not hosting the final episode of Breaking Bad, so I don't know actually what it could be, but we're quite certain we're going to be able to alleviate the problem in the short term.
And in the short term, are you saying the short term as in obviously before 6 months, but today?
It's my hope that we would have something done by today, and it's also I'm hoping to get updates shortly, and we'll let people know if sooner.
One last question.
We should note that there is no evidence that John Boehner was involved in this, too. So we just want to make sure. We want to eliminate any rumors in that regard.
But perhaps Senator McConnell?
No.
Okay, I think that we're done with the Q&A portion. Thank you very much.
Thank you very much. Let's go insure people. Thanks a lot.
People will be